Hello everyone, myself Dr. Shabana Nanzeen. I am consultant nephrologist and transplant physician. On the occasion of the World Kidney Day, which is celebrated every year on the second Thursday of the March. So this World Kidney Day today, this year will be today, that is 9th March. So every year World Kidney Day will be having the separate theme. So this year theme, that is 2023, the theme is kidney health for all and preparing for the unexpected things and supporting the vulnerable population. So what does it mean and what is the importance of the World Kidney Health Day? So World Kidney Day, usually it is started from 2006 with the help of the ISN. So every year we celebrate World Kidney Day to promote the awareness about the kidney diseases and to promote the health benefits and of the population who are vulnerable, like diabetes and hypertension patient. So coming to this year theme, that is kidney health for all. There are three things in this theme, that is kidney health for the all. So coming to kidney health for all, what does it mean? It means that whether the patient is is a child or the old 70-year-old person, all from different age groups require the different care so that we can protect all our kidneys. So what is the role of the kidney? Actually, we know the kidney is an important organ of our body which helps in maintaining the BP, which helps in maintaining removing the waste material from our body. So such a vital organ, so it's our duty to improve the kidney health. So coming to suppose pediatric population, like children will suffer with the kidney diseases like nephrotic syndrome. That means they may be losing the protein in the urine. So that will be we have to take care, and pediatricians will take care of the child. They will recognize who are suffering with the nephrotic syndrome. They will try to manage. If they are unable to manage, then they will refer to the nephrologist. Then coming to the women, that is the if they are in pregnancy or if they are in the growing age, adolescent age. If suppose pregnant lady, if she has her creatinine is more than 0.8, that means she is suffering with AKI. So that we have to take care of the pregnancy and all the complications like preeclampsia and all those things should be dealt. Then so different age groups require the different care of the kidney so that we can promote the soft functioning of the kidneys. So then the preparing for the unexpected, what does it mean? Preparing for the unexpected, as we know that we have faced the COVID era, that is COVID pandemic. So that time our patients, like the chronic kidney disease patients who require the dialysis, they were facing many issues because they were sudden shutdown of their dialysis centers. They have to shift from one place to another place because of the dialysis. So for such unexpected things, like recently we had an Ukraine war, then we have an earthquake in the Turkey and Syria. So all this during these emergencies, during these disasters, whether it is natural or the man-made disasters, during that time we should be prepared for the unexpected, so that because our kidney patients, like they are not on the monthly treatment, they are on the weekly treatment where they have to go to the dialysis center 3 times a week. So for such patients, for our patients, we require proper planning. So to avoid such unexpected things and to avoid the delay in the care of the patients of the chronic kidney disease, this year theme, it also involves the we have to prepare for the unexpected. So this is like it's an government and the government policies. This is mainly with the policies how we can plan and how we can avoid these unexpected things, and how we can provide the patient care during these unexpected situations. Because patient will be having the financial disturbances, emotional disturbances and physical disturbances. Then coming to the main theme, that is supporting the vulnerable. What does it mean, supporting the vulnerable? Supporting the vulnerable, it again, it's like suppose patients with comorbidities. So patient with comorbidities means like diabetes, hypertension, obese patients, are patients who have the family history of kidney diseases, are patients who have the recurrent renal stones, are patients who are losing the proteins in the urine in the childhood, and all these patients comes under the vulnerable categories, that because we need to take care of these patients. So main important thing is they should be aware that suppose if a diabetic patient, he or she should be aware that if I am a diabetic, my sugar should be under control. And diabetes is a lifestyle change disease. So if you change your lifestyle, you can control your sugars. And once in a year, if you are a diabetic and hypertensive, you should visit a nephrologist. or otherwise you should consult your treating physician and you should ask them to do the urine simple two tests, that is urine examination and the one blood test, that is creatinine. So they will check whether you are losing any proteins in your urine or whether you have any normal range of creatinine or it's above the normal. So every year diabetic or hypertensive patient are the high risk group, suppose if you have a recurrent kidney stones, so or if you have or if you are an obese patient, or if you are having the family history of kidney disease, or if you are more than 40 years, so it's your duty to at least annually you do your two simple tests, one urine test and blood test, so that you will be aware of the kidney diseases. What if I am not going for the regular checkups, if I am a diabetic and hypertensive, then it means that person. So to prevent this silent disease, we should be careful, and all these comorbid patients should do their routine, at least annual examination of the urine and the blood test. Then who are the other vulnerable patients? So one thing is the comorbid patients, second is the our dialysis patients. These are the vulnerable patients because they are exposed to the diseases, infections, because they have the low immunity, their nutrition is compromised, and their emotional and the both financial burden is there on them, because they have to go to the dialysis center for 3 times a weekly. That means they are spending 12 hours of their week in a dialysis center. So that will ultimately lead to the compromised lifestyle. So this year we should support these people, support these new dialysis patients, and even emotionally also, and we should thank the attendants, that means family members who are supporting these dialysis patients and who are encouraging them. Then coming to other vulnerable group is like children and pregnant ladies and elderly patients also. So pregnant ladies, suppose if an elderly pregnant lady or some primary lady who should go for the routine and the regular antenatal checkups. That means that they should have a monthly checkups, then they should have the fortnight checkup, then they should have the weekly checkups as per advice by the gynecologist, and they should the gynecologist will also check, suppose if they are high risk patients, like if they are elderly, that means she is more than 30 years and she has some comorbidities before that, our family history of BP. So mainly in pregnancy we should be aware that whether your BP is under control or not, whether if you are losing any proteins, then you should meet the physician or you should meet the nephrologist. So suppose if patient in pregnancy, if she may have the kidney dysfunction, or the kidney patient who is pregnant, then again this is also a risk factor. So all these vulnerable patients will be supported by the treating physician, treating gynecologist, and the treating nephrologist. So the basic thing which is among the common population is you should be aware that if you are a diabetic, if you are a hypertensive, if you are obese, and if you are alcoholic, and if you are a smoker, or if you have any history of renal stones in your family, or you are suffering with the recurrent renal stones, or if you are above 40 years, it's better you should go for the annual screening of by going with the two simple tests, urine test and the blood test. So that will help you whether your kidneys are okay or not.